My name's Steph Dakin. I'm an Associate Professor within the Botnar Research Centre, and we recently published a review article in Nature Reviews Rheumatology where we discuss pathogenic stromal cells as potential therapeutic targets to treat inflammatory joint disease. During this review, we discuss how resident stromal cells which reside in soft tissues of the joint, such as the synovium, tendon, ligament and joint capsules, and we discuss how these resident stromal cells can contribute to chronic inflammation and inflammatory joint disease. Mesenchymal stromal cells include fibroblasts, tissue-resident macrophages and endothelial cells, and each of these cell populations are critical to regulating health and disease of musculoskeletal tissues. Our review discusses how mesenchymal stromal cells change their behaviour and characteristics in response to inflammatory disease of the joint, and we discuss how in an inflammatory environment these cell types show activation and dysfunction, and understanding of the biological processes underpinning activation and dysfunction of stromal cells helps to improve our understanding of chronic inflammation in inflammatory joint disease. Current therapies to treat inflammatory joint disease target immune cells which play an important role in inflammation in this process, but in some patients these therapies are ineffective, perhaps because these therapies don't target pathogenic stromal cells which are important in driving chronic inflammation in the joint. So improved understanding of how stromal cells drive inflammation and cause tissue damage is important to help advance our ability to find new therapies to target these pathogenic stromal cells driving inflammatory joint disease. The discovery that distinct synovial fibroblast populations drive inflammation and also drive tissue damage in the joint helps to inform more precision therapeutic targeting of pathogenic stromal cells in inflammatory joint disease. So it's important that future therapies, for them to be effective, they need to directly target the pathogenic stromal cells driving disease. But in addition, future therapies need to target the crosstalk or the communication between pathogenic stromal cells and how these cells communicate with infiltrating immune cells in inflammatory joint disease. So collectively, this knowledge helps to shape the therapeutic landscape and provides exciting new opportunities to directly target pathogenic stromal cells driving inflammatory joint disease, with our ultimate goal to find new therapies that promote resolution of chronic inflammation and inflammatory joint disease.